Dr. Bayasi, I'm going to bring you into the conversation here. Jodie had surgery to address her colorectal cancer, and as a surgeon myself, we often are the first port of call to address a cancer diagnosis, both in terms of giving that initial diagnosis and removing it surgically before patients even get to an oncologist. So I'm sure you've had many situations where you've been the first to break the news, and with surgery, it happened very quickly for Jodie. Within a week, she was on the operating table. Tell us how patients deal with that diagnosis at the same time as having to face potentially life-threatening and life-altering surgery.
Absolutely. So, first of all, a lot of the patients comes in not even knowing why they're seeing me. They come in, they said, I just had a colonoscopy and I was told to go see a surgeon. I do think that it's probably not fair for the patient. I think the patient should be well informed of their diagnosis step by step. For the patients that are informed, they usually come, and I always start, the conversation of how much do you know, and why do you think you're here, and how much do you want to know? I think that's, again, very important because, like John mentioned, some of the patients really like to be very informed and very well known step by step, and they were just like, I just want to, want you to do whatever is needed, and I don't want to know much about it.
So it's not a one-size-fits-all.
Absolutely, absolutely. And then the other thing is, I would tell the patient that we know that this is cancer, and we may know a little bit about what stage we're dealing with, but some of the final steps will be done after the surgery, because the cancer diagnosis or the stage of the cancer will be determined after we remove the specimen actually and looked at what stage under the microscope and if the lymph nodes are involved or not. In the pre-operative testing, the imaging that we do sometimes give us an idea if we're dealing with an advanced stage or a metastatic stage. But to differentiate between stage 2 and stage 3, really the final specimen should be looked at carefully and decided what stage we're dealing with.
And we don't always have the answers when the patient is going into surgery. We need the pathology of the surgical specimen to know sometimes whether there's microscopic involvement in the tissues outside the primary tumor and potentially results from lymph node involvement. That means that we don't always address those questions that the patient wants to know. Is surgery going to cure me? We can't always answer that before the surgery.
Absolutely. And I always like to discuss that with the patient early on. Surgery is indicated in your case. It's possibly going to cure you, and even if it cures you, if there's involvement of the lymph nodes, the possibility of the cancer coming back is higher without chemotherapy, and that's why chemotherapy is indicated. The good thing about colon cancer, I think we have done a lot of, there's been a lot of advances in the treatment, whether surgically or oncologically, but I think there's still some more room to go. And the other good thing that the treatment varies quite a bit between early stages and late stages. Surgery is a crucial part. Sometimes it's the only part of the treatment, in stage 1 particularly.
And I think also, as surgeons, we're very good at answering the surgical questions because that's what we do. We're all so specialized now and becoming super specialized in cancer care. Do you find it's difficult to address questions about, for example, a patient that you've just operated on or you're about to operate on with colon cancer, and yet the patient's got questions about how much radiation do I need? Will I need radiation? Do I need chemotherapy? How's it going to make me feel? How do you deal with questions that are relevant to the cancer but are outside your area of expertise?
Yeah, that's very common because, again, a lot of the patients, since this colon cancer is common, a lot of patients had experience with a family member or a neighbor or somebody that they know. So they come in to me and said, well, will I be needing a bag? Is the bag going to be permanent? Am I going to need chemotherapy? Am I going to need radiation? Another big question they ask me, am I going to be able to have normal bowel movements? And that's very important, the question as well to address with the patient. I try to answer all the questions that I can, but I do tell the patient that depends on the specialty. I don't like to be the only one involved because we're in an era that colon cancer should not be managed by one physician. I think the involvement of multiple physicians all together on the same page, we call them the same team, will help a lot in answering all the patient's questions.